PPH is defined as a cumulative blood loss more than or equal to 1,000 milliliters or blood loss that is accompanied by signs or symptoms of hypovolemia within 24 hours after the birth process. It is categorized as either primary or secondary. Primary occurs in the first 24 hours after delivery, or also called as early PPH, and secondary PPH occurs 24 hours to 12 weeks after delivery, and also called late PPH. Depending on the volume of blood, it can be further categorized into minor and major. Minor PPH is 500, 1,000 milliliters, and more than 1,000 milliliters as major PPH. Physiological changes during pregnancy, including an increase in uterine blood flow from approximately 100 milliliters per minute in a nonpregnant uterus to 700 milliliters per minute in a pregnant uterus, cause significant bleeding. Coagulation changes resulting in a hypercoagulable state, and postpartum changes like myometrial contraction and local decidual hemostatic factors prevent blood loss. Therefore, conditions that lead to a failure of these mechanisms can result in PPH. Prediction of PPH is difficult, and there is no single risk factor except the abnormal placentation. Despite number of contributing risk factors like multiple pregnancies, history of PPH, pregnancy-induced hypertension, geriamnionitis, episiotomy, pre-labor cesarean section, macrosomia, and operative vaginal delivery, PPH can develop unpredictably without any of above risk factors as well. Main causes of PPH are represented by 4 T letters: tone, tissue, trauma, and thrombin, which should be checked during management, and treatment should be directed accordingly. Uterine atony is the most common cause of PPH, and prolonged labor, precipitous labor, uterine distension due to macrosomia, polyhydramnios, multiple pregnancy, poor uterine contraction due to grand multiparity, submucosal fibroids, geriamnionitis, abnormal placentation, retained placenta, and use of uterine relaxants like nifedipine and magnesium sulfate are causative factors of uterine atony. Retained placenta or placental membranes are the examples of tissue. Uterine rupture, uterine inversion, cervical tears, episiotomy, and instrumental deliveries are the causative factors of trauma. Gestational thrombocytopenia, sepsis, anticoagulant therapy, eclampsia, and pre-existing coagulation disorders are the examples of coagulation disorders. Estimation of blood loss can be done using the following simple equations: soiled sanitary towel equal to 30 milliliters of blood loss, soaked sanitary towel 100 milliliters of blood loss, small soaked swab of 10 times 10 centimeters in size equals to 60 milliliters of blood loss. Large soaked swab of 45 times 45 centimeters in size equals to 350 ml, and full kidney dish equals to 500 ml blood loss. Management of PPH will be discussed in separate video. Thank you for watching. See you in next video.